We know that families are busy and that it can be overwhelming to have lots of therapy and medical appointments. We aim to simplify this for you by providing you with the right support at the right time. If you're unsure what support you need, or if your child needs the involvement of multiple services, a key worker can help to streamline this process for you. Research shows that families benefit from having one main therapist who they trust, and it makes getting support more manageable, leading to improved outcomes for children and families. Family-centred practice is at the core of our services. This is how services are delivered rather than what is delivered. Family is central. We listen to the family and what is most important to them. We take the time to get to know you and your family. Your child is our focus. We are there for the benefit of them. But what we know is how well a child functions is dependent on how well the family is going. We know that if your child is having difficulties, this impacts on the whole family, but also that the opposite is true. So instead of us coming in with ideas about what therapy should look like and what the priorities are, we work with you to determine what is most important to you and how we can support you and your child to achieve that. We look to build upon your family's strengths, helping you to use the resources available to you. Once we've set your family goals, looked at the resources available to you and how the key worker can support, we'll then work with the wider interdisciplinary team to help coordinate your therapy. Your therapy team may include occupational therapists, speech pathologists, positive behaviour support practitioners, psychologists, physiotherapists, dietitian, exercise physiologists, early childhood teachers, special education teachers, social workers and allied health assistants. The involvement of this team will look different for each child and family. Sometimes it might be as simple as a quick question for someone else on the team. We might ask another discipline to join us on a visit to provide strategies, and sometimes they might suggest a therapy block to help address one of your specific goals. There'll be other times we might suggest a referral to another team if a formal assessment or report is needed, or if we think that ongoing support is needed. We know that children learn best in their everyday environments, so where we can, we like to work in your home, the community, or your child's learning environment. This helps us to embed therapy in your everyday routines and build the capacity of adults who support the child. We are there for 1 hour, the family and their teachers are there for the rest. So we want to find as many opportunities as possible in all of those other hours for them to work towards those goals. That's where the magic happens. So we'll join you at your home, the shops, the park, so we can see what's happening and provide practical supports. We will partner with you to support your child's inclusion and participation within the wider community.